Are you suffering from jaw pain? Jaw pain is due to temporomandibular joint disorders. We shortly call it as TMD. TMD encompasses a group of symptoms that includes jaw pain, pain during closing and opening the mouth, pain during biting hard foods. Sometimes when you open the mouth, the jaw gets locked and it doesn't close. Sometimes you'll be unable to open at all. It is called as closed lock. So it also causes ear symptoms, and it can cause headache, and it can cause pain over the jaw area and so on. It's a very complex condition to treat because the right jaw and the left jaw are having two joint cavities. Essentially, they are having four joints. So whenever the right joint moves, the left joint also will be inevitably moving. So problem in one side can easily go to the other side. The jaw joint is a very frequently used joint in the body. It is moving when we are talking, when you are laughing, when you are eating, when we are doing some parafunctional habits like nail biting or lip chewing. So these are some of the instances when the joint can get repeatedly used, and that can lead to the pain. Oftentimes, the patients will be confused which doctor to meet when they have a jaw pain. So they probably go to the dentist as the first contact practitioner because they think the jaw joint is closely related to the dental structure. So there must be something problem with the dental structures. But in reality, the jaw joint is like any other joint in the human body. Like how a shoulder joint hurts, the jaw joint hurts. It must be first dealt with the joint perspective, and then it should be dealt with the muscular perspective. Then it should be dealt with the neural perspective, and finally it should be dealt with the dental perspective. So it should be dealt in this sequence. So some of the jaw pain can be because of muscular problem, like there will be a knot in the muscles because of excessive usage of the muscles. Like some people will be doing repetitive nail biting, or some people would have got a trauma, and then that can cause a swelling and the tightness in the muscles. The tight muscles can cause jaw pain. So these muscles include masseter and the temporalis and the lateral and medial pterygoids. Sometimes the sternocleidomastoid muscles can cause pain in the jaw area. The next possible reason for the jaw pain is the joint problem. The jaw joint itself can be the reason for the pain. Unlike the other joints, the temporomandibular joint has two joint cavities which is separated by a disc. So this disc can slip anteriorly. We call it as a anterior disc displacement, which can abruptly lock the joint, and the patient will have limited mouth opening. It can also cause click sound and then clunk sound and so on. So this problem is emanating from the joint itself. So when someone has a jaw pain, after seeing the muscular source, you need to go to the joint as a source of the pain, and usually the disc has to be recaptured by certain exercises, and the disc can be recaptured by certain forms of mobilization techniques and so on. The third possible reason for the jaw pain could be the cervical problem. You know that the jaw joint is innervated by a nerve called trigeminal nerve. The trigeminal nerve is the fifth cranial nerve, which has a sensory component which is shared with the cervical spine. So when there is a problem in the cervical spine, the trigeminal nerve area, which is somewhere here, will get sensitized. And since the area is sensitized here, the patient will feel pain here, and they think it's a jaw problem. Even though the patient may have a true joint problem, when the nerve is sensitized, the pain will be doubled or tripled. So in such cases, we need to address the cervical spine, because the problem in the cervical spine, like disc bulge or the nerve compressions or the dural irritations, this can sensitize the trigeminal nerve, and that make the entire area painful. Trigeminal neuralgia is one of the condition which is an example for this. So it is these people who are having an underlying cervical problem who will be having failed treatments, because these people will not get improvement by any muscular or joint based treatment or even splint based treatment, because the underlying problem is in the cervical spine. So any professional who is treating your jaw pain must be well aware of the cervical contribution of their jaw pain, so that if at all any contribution is there, okay, that must be addressed as the first line of treatment. In such cases, you don't go for any irreversible procedure or any invasive procedure into the joint, because that will lead to a catastrophic results. The last reason for the jaw pain could be the occlusion problem. So people who have underbite, or sometimes overbite or overgite or cross bite, in such cases the bite abnormalities can cause an abnormal biomechanical loading force to the joint that can be the reason for the jaw pain. So in such cases, you need to give dental appliances and occlusal splints or mandibular repositioning splints with the help of dentists. So the dentists are the people who will be measuring the bite, and then they'll be the right person to give the splints. But it should be done in coordination with the physiotherapist, because After the splinting also, the patient must be able to do certain exercises to maintain the improvement. So the jaw pain must be treated by all these four perspectives. The treatment must be given by a physiotherapist in coordination with the dentist. We have been training some dentists also in order to treat the TMJ problem. So these dentists are well versed in these concepts what we are saying, but most of the dentists have only the knowledge towards the occlusion problem. They don't have a knowledge towards the first three components I have mentioned. So but the jaw pain will happen due to all these four reasons. So any professional who is treating the jaw pain must know the pathoanatomical model. That means which structure is the reason for the pain and how the anatomy is disrupted to cause an abnormal biomechanical alignment and the forces in the joint. The second thing is neurophysiological, how the nerves and the nerve pathways and the receptors are sensitized. And here I need to include the brain, the spinal cord as well. How these neurophysiological pathways are sensitized to contribute or amplify the overall pain perception of the patient. So someone who understands both the pathoanatomical model and the neurophysiological model are the one who will be able to give the right intervention for you. See, the TMJ problem is not that easy to treat because it needs a lot of understanding of so many structures involved in this, and it's very hard to find a professional who can deal with it in an effective way, economical way, and a permanent way. So we at APTER Institute, we deal with temporal joint dysfunctions. We train other dentists in terms of how to manage the TMJ problem. If you have any TMJ problem, feel free to write to us, or we can mail us, or come and visit us. We will offer you a best solution at a cheaper cost and a more effective way and in a very short span of time. Thank you.